Hello, and welcome to FNHA's learning module on the iStat Analyzer. By the end of this module, you will be able to identify the parameters of using the iStat, describe the basic iStat cartridge handling guidelines, describe proper sample collection and handling practices, list the factors that may affect the samples prior to analysis, review and record results, and perform the basic quality controls. First, let's talk about the when, the who, and the how of using the analyzer. A physician or NP's order is required for all tests performed on the iStat. Use is for urgent or situations requiring point-of-care results. This system is not to be used for routine blood work at this time. Testing may only be performed by certified point-of-care testing personnel. This means that you will need to complete this module, the quiz and a competency checklist, prior to using the analyzer. Testing must be performed in accordance with FNHA procedure and established testing protocol. These procedures can be found on your nursing station's gathering space site. Do not take the analyzer out of the nursing station, for example into a patient's home, as temperature variations can affect the analyzer and battery. There are a number of different components to the iStat system that we will be discussing in this module. First, there are the cartridges, which is where the samples are placed and then inserted into the analyzer. The printer, which prints out the test results. The downloader recharger dock, which recharges the battery and updates the device software. The analyzer, which analyzes the sample and displays the results. And the external electronic simulator, which checks if the analyzer is functioning properly. There are a few main things to keep in mind regarding cartridges. First of all, they need to be stored in the immunization fridge of the nursing station, as they need to be maintained between 2 and 8 degrees. Each new lot number that arrives will need to be quality control checked, and we will discuss how to do this later in this module. The other main point to know about cartridge handling is that they need to be brought to room temperature before use. This means you will need to remove a cartridge from the refrigerator 5 minutes before adding the patient's sample to it. If for some reason you removed a cartridge from the refrigerator and did not open or use it, for instance if the physician or NP changed their orders, follow the directions on the package for how long it can be kept at room temperature and still be viable for use. You cannot put a cartridge back into the fridge after you've taken it out. You will need to put the temperature expiration date on the unopened package and communicate with the other nurses you're working with to use it within the required date range instead of using a refrigerated one if the need arises. Now that you have received a physician or NP order for using the iStat and removed the cartridge from the refrigerator to start coming to room temperature, you will need to prepare the analyzer. To turn it on, press the power key and select option number 2 for iStat cartridge. Next, you will need to enter your operator ID. For FNHA staff, this is your employee number. For agency staff, you must enter your first and last initial, then press the Enter key. The analyzer may ask you to repeat the entry. Next, enter the patient's personal health number. The iStat will run automatic internal QC checks. If any of these fail, you will get a quality check code prompt, which we will discuss in the QC section of this module. Now that you have prepared the analyzer, you will have 15 minutes to obtain your sample, fill the cartridge, and insert it into the analyzer. If you're unable to obtain a sample and run the test within 15 minutes, the analyzer will shut off and require you to go through the analyzer preparation again. There are some important points to know about the collection of samples depending on which cartridge you're using. For samples collected within FNHA sites at this time, the samples will be either venous sample collections or, in the case of PT-INRs, a finger poke sample. It is very important to ensure your sample collection technique follows the recommendations for each cartridge, as not doing so may affect your results. For instance, for collection of PT-INRs, you can gently squeeze the finger to obtain a hanging drop of blood to drip into the cartridge, but it's important not to repeatedly squeeze the finger, as this can cause hemolysis or tissue fluid contamination of the specimen. You will be using either a green or purple top tube for venous sample collections. It's important to test within the time allotted for each cartridge, or your results may be affected. If you are drawing samples for use in multiple cartridges, be aware of which cartridges should be run immediately and plan accordingly. For example, if you have received orders for both a Chem 8 as well as a CG4, you recognize that time to test for Chem 8s drawn in a green top tube is 10 minutes, while CG4 time to test is immediately. Therefore, you would run the CG4 first, then the Chem 8 from the sample tube. You will need to follow the FNHA procedure for collection of client samples, which can be found on your station's gathering space site, including patient identification. Next, we will talk specifically about sample collection techniques and things to avoid. An important point to keep in mind with any point-of-care testing is always correlate results with the status of the patient. In addition to testing the sample within the time parameters, it's important to remember a few key things regarding obtaining a sample. These are points that, again, if not followed, can give inaccurate results. Do not draw from an arm with an IV line running, and do not draw from an IV start. Do not allow the sample to be exposed to air. Do not place the sample on ice, and do not let the tourniquet stay in place for longer than 1 minute. If testing lactate or blood gases, collect without a tourniquet or immediately after the tourniquet is applied. Do not have the patient clench and unclench their fist, and ensure that you allow your alcohol prep to completely dry or your sample may become hemolyzed. Ensure the device is on a flat surface when running samples. For example, do not place it in the charger, and avoid anything that will cause hemolysis. Both the white and blue cartridges need to be handled carefully, or you will get a quality check code. Hold them by the sides or bottom, and do not put pressure on the sensors or in the middle of the cartridge. Careful filling of the cartridge will help avoid error codes. You will need to mix the sample thoroughly and gently by inverting the tube or rolling the syringe between your palms. Remember, if you're using a syringe or a dispensing tip, to discard the first few drops before adding the sample to the cartridge. Always fill to the fill mark on the cartridge. When using a dispensing tip, you will need to still invert the tube end to end a minimum of 10 times. Remove the cap from the dispensing tip, insert the blood collection tube, discard the first few drops of blood, and fill the cartridge to the fill mark. Remember, if you're using blood from one tube to fill 2 cartridges, for example, you need to run a Chem 8 and a troponin, you will need to mix gently, discard a few drops of blood, then fill the first cartridge, wait for it to be analyzed, remove it from the analyzer, then gently remix the tube by inverting it 10 times prior to dispensing into the next cartridge. If you do not have a dispensing tip, you can use a syringe. Gently invert the tube 10 times, draw the sample into the syringe, and then roll the syringe between your palms. Discard the first few drops of blood and then fill the cartridge. Again, if you're using blood from one tube to fill 2 cartridges, you will need to invert the tube gently, withdraw the sample with a syringe, roll the syringe between your palms, and fill the first cartridge. You will wait for this first cartridge to be analyzed, remove it from the analyzer, then gently remix the tube by inverting it 10 times, withdraw your second sample into a new syringe, roll it between your palms, and dispense into the second cartridge. You will need to promptly insert the cartridge into the analyzer. A cartridge locked message will appear. You must not try to remove the cartridge when a cartridge locked message is showing, or it could damage the analyzer. When the test is complete, the results will be displayed and it is then safe to remove the cartridge. The results screen will show you the patient ID, time and date of test, type of cartridge, and the results. If the results are shown over two screens, you can use the arrow key to navigate between the two screens. Reference ranges are indicated with a bar graph and tick marks. If the bar graph ends before the first tick mark, this indicates a low result. If it is after the last tick mark, this indicates a high result. And between the tick marks indicates results are in range. Critical results will be shown with up or down arrows. These require you to notify the physician or NP immediately. You may need to repeat the test, making sure that your sample collection technique is correct. Out of reportable range flags again will require you to notify the physician or NP immediately and may require you to redraw the sample. Always correlate your results with your patient's presentation. If you see star outs where 3 asterisks appear instead of test results, this means that there is a problem with the sample, cartridge, or the analyzer. To transmit the results to the printer, you can either place the analyzer in the downloader if it's connected to the printer, or point the analyzer at the green status lights on the printer, holding it between 3 and 12 inches away from the printer. Then press the print key on the analyzer. Do not move the analyzer until the results have printed. So now what? As mentioned in previous slides, all results must be communicated to a physician or NP. This will need to be done both verbally and via fax. If the results are critical, the physician or NP must be notified immediately. Once you have the printout of the results, you will need to photocopy them prior to faxing. You can place them on an iStat results page or a blank piece of paper for photocopying. This will allow you to include patient information, the nurse's information who collected the sample, and who the results were faxed to. It will be this photocopy you place in the chart. The reason for this is the ink on the printout will fade quite quickly. Once you have this photocopy, you can shred the original printout. You will place this results page into the lab section of the chart. You will document in the plan section of your SOAP note. You must include all the tests that were ordered and the name and location of the ordering physician or NP. Document the time and anatomic location of the blood draw. Document any critical levels. Don't just say critically high troponin. Give the actual level. If you have normal results, you can say all results within normal range. See results page in lab section of chart. You will need to clearly identify that you have both faxed and verbally notified the physician or NP of the results and any additional orders received. You may be required to fill out information on the iStat tests that you run on the daily log. Check what your site's tracking requirements are prior to using the device. You may also be required to submit information for evaluation of the iStat implementation project. Check if your site has any evaluation reporting requirements. So now let's talk about the basic quality controls you'll need to perform on the iStat system. The quality control system includes an internal electronic simulator, an external electronic simulator, and liquid QC checks. We will be going over when each of these is performed and how. The internal electronic simulator is something you don't need to worry about initiating. It's internal to the device and automatic. If the simulator test passes, the analyzer will continue to operate as it normally does. If the test fails, you will be notified and will need to complete an external electronic simulator test. What the external electronic simulator looks at is the ability of the analyzer to take accurate and sensitive measurements. To run the external electronic simulator test, you will need to turn on the analyzer and press Menu. Press 3 for Quality Tests and press 4 for Simulator. Enter your operator ID, which is your FNHA employee number, or for agency staff, your first and last initial. Enter the simulator ID and insert the external electronic simulator. The test will take 60 seconds. If it fails, you will need to repeat the test. If it fails again, contact the Abbott Technical Support Line for troubleshooting advice and direction. Notify the Nursing Operations Manager via email. Liquid quality control tests need to be performed on every new lot of cartridges received, as well as monthly as part of the monthly admin checks for the nursing station. First, turn on the analyzer and press the menu key. Press 3 to select quality tests. Press 1 to select control. Enter your operator ID. Scan or manually enter the control lot number and scan the cartridge lot number. From this point, you will have 15 minutes to complete the quality control check. If you are QC checking using a glass ampule, you will need to let it sit at room temperature for 4 hours prior to use. There are 2 to 3 levels of liquid controls, low, normal, and high. They're used to monitor how well cartridges perform at low, medium, and high clinical ranges. You may only have 2 levels of QC solutions, which is acceptable. Once you've removed the ampule from the fridge, it must be used within 5 days. Once the ampule has sat at room temperature for 4 hours, you will need to shake it vigorously for 5 to 10 seconds. Use a pipette to transfer the solution from the vial to the cartridge. You will need to access the Abbott website and navigate to the Value Assignment Sheet, or VAS, for the cartridge you are quality control testing. You will need the clue number of your analyzer to be able to find the correct sheet. If you are unsure what your analyzer's clue number is, you can find it by selecting the Display option on the analyzer screen when you first turn it on, and then selecting the status page. Compare your QC results with the VAS sheet and record the results on the tracking log. If results are outside of the range, contact the Abbott Technical Support Line for troubleshooting advice and direction. Notify the Nursing Operations Manager via email. The quality controls for BNP and troponin cartridges come in a slightly different format. They come in a plastic vial instead of glass, and if tightly recapped, are stable for 30 days in the fridge. They're provided in 2 to 3 levels to be able to determine how cartridges perform at low, medium, and high clinical ranges. Again, your station may only have 2 levels of the QC solutions. Do not use controls past the expiration date or, if recapped and stored in the fridge, past the 30 days that they are considered stable at. Make sure that you mix the control solution thoroughly by swirling gently. Avoid making bubbles. Dispense a drop of the solution into the cartridge and insert the cartridge immediately into the analyzer. Again, you will need to go onto the Abbott website and find the value assignment sheet and compare the range you have obtained against the value assignment sheet. Document this on the QC log. QC testing for PT-INR cartridges uses vials that need to be reconstituted from 1 vial of dry lyophilized human plasma and 1 vial of diluent. Only 1 cartridge can be tested with the reconstituted solutions. You will need to take the vials out of the fridge and let them sit at room temperature for 45 minutes prior to use. Do not use if they have been sitting out at room temperature for more than 4 hours. Once the vials have been sitting at room temperature for 45 minutes, you are ready to begin. Start by removing the cartridge from the pouch. Next, remove the cap and stopper from the vials. Pour the entire content of the diluent into the lyophilized plasma vial. Replace the stopper and allow the vial to sit for 1 minute. Next, gently swirl the vial for 1 minute, then invert for 30 seconds. Using a pipette or syringe, immediately transfer the solution to the cartridge, close, and insert into the analyzer. Again, the results will need to be checked against the Abbott website's value assignment sheets and documented on the QC log. Congratulations! We know that this is a lot of information in a short amount of time. but hope that you have found this module helpful as you learn to use the iStat effectively. You will need to complete the quiz and competency assessment to be considered certified for point-of-care testing using the iStat device. If you have any questions, please don't hesitate to contact the Practice and Education team. Procedures for the use of the iStat are found on the gathering space, and you will need to refer to these to guide your practice. Now that you have completed this module, you will need to complete the quiz and competency checklist to be considered certified for use of this device.